So hello my dear friends and colleagues and fans everywhere. I will continue talking about the lung-kidney interaction, and let me focus on this presentation on talking on pneumonias and the kidney pathology and kidney functions and renal manifestations of pneumonias. Since we are now, yesterday was the World Pneumonia Day. So, by the way, since I'm talking about the lung-kidney link or the lung-kidney interaction in disease, I have to mention pneumonias as an example of acute lung diseases. We all know that pneumonias is an infection or lower respiratory tract infection which involves the lower respiratory tract, namely the alveoli. And pneumonias, they might be interstitial, what we call interstitial pneumonias affecting the interstitium, or parenchymal pneumonias affecting the lung parenchyma. And they all involve anatomically the pulmonary acinus or the alveoli. And the most common cause of pneumonias, and as we all know that pneumonia pathologically means an area of consolidation, which is an airless part of the lung, whether it is affecting a lobule or a lobe or massive, but it is an area of consolidation pathologically. And consolidation means an airless part of the lung due to infiltration by inflammatory fluid and exudate. And the most common causes of pneumonias in practice is infections, although we have other causes of pneumonias like toxic, like chemicals, like radiation, etc. But the commonest is infectious causes. And the infectious range of causes, they include many agents, bacteria, viruses, fungal infections, that's mycosis, different types of mycosis, especially Candida and Aspergillus, and of course parasitic pneumonias due to many or a wide range of parasites which involve the lungs, and they might cause also pneumonias. But let me focus on bacterial pneumonias and viral pneumonias, which are common in everyday practice, bacterial and viral pneumonia. Especially, of course, we know that Streptococcus pneumonia is the commonest cause of bacterial pneumonia, and of course we all know that pneumonias are classified into what we call CAP or community-acquired pneumonias and nosocomial or hospital-acquired pneumonias. Pneumococcus or Streptococcus pneumonia is one of the commonest causes of bacterial pneumonias in clinical practice, the pneumococcus. Also, other common bacterial agents are the Staphylococcus aureus, also Haemophilus influenzae, also Klebsiella pneumonia, also Pseudomonas aeruginosa. These are common typical causes of typical pneumonias, and we have other atypical causes of atypical pneumonias like Legionella pneumophila, for example, and other range of bacterial atypical pneumonias. But especially common is the Legionella, causing Legionnaire's disease. Let me go back to the commonest causes of typical pneumonias, whether the community-acquired or the nosocomial or hospital-acquired pneumonias. We have the pneumococcus being the most common, and together with the Haemophilus influenzae and the Klebsiella pneumonia, and also Staphylococcus aureus as well. And the viral pneumonias is another common category in clinical practice, especially complicating upper respiratory tract infections, and the commonest viral infections responsible for lower respiratory tract infections and pneumonias are the influenza with all its types, influenza A, especially influenza A and influenza B. Influenza C is rather rare and is a mild disease usually. But influenza A and B are common causes of influenza pneumonia. Also other viruses like the parainfluenza virus, like the echovirus, like the respiratory syncytial virus, like of course, the coronavirus or the COVID-19, COSAS-2, and rhinoviruses. These are also common causes of viral pneumonias in clinical practice. Pneumonias In general, they can be complicated by kidney problems, either directly or indirectly. But the renal complications in general in pneumonias, they are not common. And it only happens if the patient has bacteremia and septic shock. And here, which is rather a rare complication, systemic complication of pneumonia, especially in cases which are not diagnosed in the proper time and untreated cases of bacterial pneumonias. They might be complicated by septicemia and septic shock. So, if the patient is complicated by septic shock, here there is a high propensity to renal failure and acute, whether pre-renal failure or due to pre-renal causes, or directly related to the kidney with intrinsic renal failure due to acute tubular necrosis, which is either ischemic or toxic, or acute glomerulonephritis in some cases, also complicating some bacterial pneumonias. So whether it is acute tubular or acute glomerular causes causing intrinsic renal failure, or due to pre-renal causes due to the shock, hypotension, dehydration from excessive vomiting in many cases, these are pre-renal factors which cause to, or which lead to what we call pre-renal failure or pre-renal acute renal failure, which with neglect of the case might affect the kidney and cause intrinsic renal pathology with intrinsic renal failure, as I mentioned, due to acute glomerular injury or acute tubular injury, or mixed acute glomerular and acute tubular. So toxic complications of pneumonias, they might lead to acute kidney injury, complicating septicemia, complicating pneumonias, especially in bacterial pneumonias, as I mentioned. Another issue of evolution is that some of these cases, they might be complicated by acute pulmonary edema, what we call acute adult respiratory distress syndrome. And the ARDS, or the adult respiratory distress syndrome, they are associated with hypoxic respiratory failure or hypoxemia, and the hypoxemia might affect the kidney also, causing a wide range of tubular and glomerular dysfunction with hematuria and proteinuria. So hematurias and proteinurias are common non-specific findings in hematuria, and proteinuria are common non-specific findings in patients with pneumonias. And they might develop into frank acute nephritic syndrome in cases of acute glomerulonephritis complicating some acute bacterial pneumonias. So they are either asymptomatic urinary findings, this might be the renal presentation, or acute nephritic syndrome due to acute glomerulonephritis, maybe another presentation. In chronic infections or chronic pneumonias, they might be complicated by a third category of renal complications, which is nephrotic syndrome or nephrosis, with the classic triad of massive proteinuria, hypoalbuminemia, and edema, with hypertension in some cases, with hyperlipidemias, with hypercoagulability as complications of nephrotic syndrome. And as I mentioned, cases of septicemia in complicating also acute pneumonias may cause septic shock and acute kidney injury in such cases. This is the relation between the typical and pneumonias and the kidney. A typical pneumonia, especially Legionella infection or Legionnaire's disease, the major presentation of Legionella pneumoniae infection of the lung, they might also be associated with some non-specific urinary manifestations, microscopic hematuria, mild to moderate proteinuria, but not more than that. In extreme cases, there may be also involvement of the kidney by some sort of, but this is rather rare, they might be complicated by acute glomerulonephritis also in some rare reported cases. So, but the most common is asymptomatic urinary findings of microscopic hematuria, and mild to moderate proteinuria complicating a Legionella infection of the lung or Legionella pneumonia, as a common example of atypical, what we call atypical pneumonias. Also in viral pneumonia is the same. Microscopic hematuria and mild proteinuria might be common also renal manifestations of acute lung pathology in such cases of viral pneumonias, like in influenza pneumonia and in parainfluenza and in respiratory syncytial virus pneumonia and in even COVID-19 pneumonias also. So this is the effects of pneumonias on the kidney or the renal manifestations and the renal complications of pneumonias as an example of acute lung disease. By this I will finish my talking about pneumonia and renal pathology in clinical practice in short, and let me continue in my other presentations talking about the lung-kidney link in clinical practice. Thank you so much. Have a good day.